Good evening, everyone. Thank you for joining this webinar. We have had a lot of demand for this webinar on multisystemic therapy, or MST, from many people from different backgrounds, including social work, education, and psychology, as well as interested community members. So today, John and I will be presenting some information about this evidence-based treatment for at-risk youth. And we will also hear from Alicia, a mother who has had a successful experience with MST. We will also have a question and answer session at the end of this presentation. So for those of you watching this webinar live, please write in your questions. So what is MST? Broadly, MST is a family-based intervention model for youth who are between the ages of 12 and 17, exhibiting continuous antisocial behaviors such as repeated substance use or skipping school. These youth may even have been involved with the juvenile justice system. For youth referred to MST, there may seem like there are no other options to help them improve their behavior. Youth who are not eligible for MST include youth who are living independently or actively homicidal, suicidal, or psychotic. Families are the central focus of MST, and caregivers are crucial to the treatment process and change. MST focuses on empowering caregivers to gain the resources and skills necessary to be more effective caregivers to their children and help decrease their adolescents' antisocial or delinquent behavior. One key assumption of the theory of change for MST is that an adolescent's antisocial or delinquent behavior is driven by the combination of multiple risk factors that are associated with the multiple systems that adolescent is engaged in. MST focuses on these systems, including the individual, that is, the referred adolescent, and the adolescent's family, peers, school, and community. This might look like the following. An MST therapist assesses family and marital relations, as well as caregiver skills, such as setting clear rules and consequences. Regarding peers, interventions help caregivers remove their adolescent from deviant peers and assist the adolescent in developing social skills needed to form relationships with pro-social peers. Reward contingency, or providing the adolescent with a reward when acting in a desired manner, can also be implemented for adolescents engaged in substance use. Finally, MST therapists engage caregivers, teachers, and other key stakeholders, such as community leaders, to help implement interventions that promote the education and job-related aspirations of the youth. So what does MST look like in action? Although we will hear later from Alicia on her experience with MST, this image provides an excellent summary of treatment planning and intervention. Once a family is involved with MST and an MST therapist is assigned to work with them, the referral behaviors are examined. Based on referral behaviors, a clear understanding is reached about what outcomes and goals are desired. Each referral behavior is examined to understand its fit within the multiple systems the youth is a part of, including identifying potential drivers of the referral behaviors. Fit circles are a helpful tool for identifying potential drivers of referral behaviors. Typically, the most problematic referral behaviors and drivers are prioritized. Intermediary goals, typically set on a weekly basis, help reach the overarching goals. Interventions are developed and implemented weekly. Intervention effectiveness and encountered barriers to success are evaluated. Potential drivers of referral behaviors are also reevaluated as needed. This process is continued weekly until the end of treatment. Throughout this process, the strength of the family and its own ecology are taken into consideration.
The implementation of MST follows a home-based delivery model, meaning the therapist comes to the home. The MST treatment team consists of 2 to 4 therapists, with one family assigned one therapist. Therapists typically have a master's degree and can be trained in a variety of fields such as social work, psychology, or marriage and family therapy. The team also consists of a supervisor, a consultant, and a coach who do not work directly with the family but help ensure that MST is being implemented correctly through the quality assurance, quality improvement system for MST. The treatment team is available 24 hours a day, 7 days a week, and deliver all parts of the treatment. The typical length of treatment is 3 to 5 months with at least 60 hours of contact between the family and therapist. The therapist assigned to the family works in the home, school, and community. While MST is intensive, change does happen quickly. Success in treatment involves reaching, even if partially, overarching goals set by the therapist and family that typically address the troubling referral behaviors. In addition, the family should be able, without the help of the MST therapist and team, to be able to carry out skills and tasks learned, such as setting and enforcing rules to help maintain the treatment success. And completion rates for MST are excellent, with studies reporting completion rates of MST among families as being as high as 98%. And now I'll turn the webinar over to Alicia, a mother who will describe her experience with MST.
Thanks, John. Hi, everyone. I was involved with MST last year. And to give you some background, my daughter Kate had just started high school. And over the fall, I noticed that she went from being a normal teenager to this person that I barely recognized. I started getting calls from school that she was skipping classes and that her grades were starting to suffer. And then she got caught drinking and smoking on school grounds multiple times. At first, I thought she was just having normal trouble adjusting to high school life, but these things just kept escalating. I tried talking to Kate, but she would either ignore me or scream at me that everything was fine, and then she'd lock herself in her room. This went on for months, and I felt like she was getting more and more distant, and school was getting worse, and then she started getting into trouble with the police. She was arrested more times than I care to admit for underage drinking and smoking, and then she started getting arrested for petty theft. I was at my wit's end and terrified I was going to lose her. One day I confronted her about everything, and she blew up at me and started screaming, and then she started to throw things. Kate was out of control, and I knew then that I was in over my head and I needed help. But I didn't know what to do, so Kate's high school guidance counselor suggested I look into MST. I went to the MST website and contacted an MST provider near me. As Layla mentioned already, this is not your usual talk therapy. MST involved everyone in Kate's life. We first met John when he came to our house to see what was going on. He asked a lot of questions, not just about Kate, but also about me and my divorce from Kate's father. I told him it had happened years ago, and Kate had been managing it just fine. I explained that Kate doesn't see her father much because he travels a lot, and he was never very involved to begin with. I also told John about my struggles with depression and anxiety, but how I tried hard to keep it from affecting Kate. John also interviewed Kate's teachers and friends. I was learning that there was so much about Kate that I had no clue about. After John got a good picture of what was going on, we started MST. We looked at Kate's behaviors and outlined overarching goals for changing the ones that were causing the most trouble, and we made plans for how to do this, which included the weekly goals that helped us along. For one of these goals, I agreed to do parent training to help understand and manage my own stuff and to use that to help Kate too. One of the most important parts of MST was understanding the fit circle that Layla talked about earlier, because it really got at the heart of why Kate was doing the things that she was doing. And one of the things that we learned was that she was not coping with the divorce as well as I thought, and that this drove some of those delinquent behaviors. We also learned that her alcohol use was fueled by trying to find a new family, and she could impress her new friends by drinking with them, even if she got in trouble for it. As we moved through the program, which took about 3 months for us, Kate got in less trouble as her behavior started to change. She stopped skipping school, and her grades improved to the point where she was passing again. At the end, we had reached all the goals we had set, and I felt like I had my daughter back. We have both learned so much about ourselves and each other through this, and I'm so thankful for John and his MST team. I believe they truly made the difference. Thank you.
Thank you, Alicia. Similar to Alicia's experience, MST often results in successful outcomes. Over 30 years of research has documented how well MST helps youth and their families. Studies have been published in more than 150 peer-reviewed journals, including over 58,000 families, and there have been numerous independent reviews of MST. Research continuously shows that MST helps chronic youth offenders achieve positive outcomes both in the short term and in the long term. In fact, a 22-year follow-up study showed that youth who had received MST had fewer felony arrests, violent felony arrests, days incarcerated, and issues with family instability. Another 14-year follow-up study showed similar positive outcomes, and along with other outcomes such as fewer drug-related arrests. Finally, there's no evidence that MST is harmful for the youth and their families who try it.
Thank you, John and Alicia. We will now answer some questions from our live viewers. So one viewer asks how effective MST is compared to medication, or if it is common to combine medication and MST. Now, this is a really good question. The short answer is that it would largely depend on the case. While there is no specific medication for behavioral problems or delinquency, a comorbid disorder is often present. For example, a child may have an ADHD diagnosis that is contributing to specific difficulties. In this case, a prescription of Ritalin may be used in conjunction with MST to provide the child with the best opportunity to succeed. However, Ritalin alone may not be as effective in targeting all problem behaviors in all situations.
Okay, and it looks like we have another question from quite a few viewers wanting to know how to find a nearby MST provider. And so actually I can show you real quick about how to do that. So let's see here. So the best way to do it is to go to the and up above you can see the tab Our Locations, and when you scroll down you'll see that you can use the interactive map to find a nearby location. Or you can click the link to find a full list of licensed MST providers. And you can use the search bar to search by state, zip code, or any other information. And so MST, unfortunately, is not available in every town or even state. So if you're interested in bringing MST to your town on ways maybe how to fund it, you can go to the Resources and Training tab, Research and White Papers. And then you'll find some information here about bringing MST to your town and funding it.
And our final question from viewers is about what to ask an MST provider if you're interested in engaging in MST. So when John first came to our house to talk about MST, I asked him about his qualifications as an MST therapist. And he told me he had a master's in counseling, was certified in MST, and had an extensive experience working with the juvenile justice system, as well as in family therapy and cognitive behavioral therapy. And he said that these were pretty typical minimum MST requirements. I also asked about the qualifications of the other people on the team, and he said that they were the same, except that the supervisor was also required to have experience in managing severe family crises that involve safety risks to the family. And I also asked John about how much this would cost, because it seemed like it could be pretty expensive. And he said that this is a community-based approach and that it would be covered through the agency that he worked for. But he added that this was not necessarily the case for every family, and it depends on a lot of other factors like insurance coverage or Medicaid availability, as well as where you are and so on. So there's a lot to be considered when looking for this type of treatment. I guess you could say we got lucky because everything worked out for us with John and his team, and now we're an MST success story.
That concludes our webinar for today. Thank you all for joining.